Good morning and welcome to your weekly cup of Joe. My name is Joe King. We're here today and we're continuing our talks on post-surgical tips. We talked about a total shoulder replacement or shoulder surgery tips last week. This week we're going to talk about low back or lumbar surgery tips. We're looking at maybe a fusion, maybe a fusion and laminectomy, some sort of resection. It could be a microdiscectomy. Lots of different surgeries out there nowadays, but just want to make sure that you guys are educated on some post-surgical tips for a low back surgery. Biggest thing is, and this kind of applies to all of post-surgical tips, is knowing what your doctor's protocol is and knowing what your movement restrictions are and maybe any lifting restrictions that may be. So making sure that the doctor's got those spelled out for you, got them in writing. Typically for fusion or for major back surgeries, is you can basically abide by the no BLT. B standing for bending, L standing for lifting, and T standing for twisting. So no bending, lifting, or twisting. At least for the first number of weeks, and maybe 6 weeks, and maybe 12 weeks. Every doctor, every surgeon's a little bit different on that. So get that clarified with them, especially before you start therapy as well. Once again, you want to make sure that you are taking your medications as prescribed to stay on top of the pain. You want to be out in front of it. You do not want to have those pain episodes getting so bad that they're making things really, really bad for you, and causing you to lose days of good, productive progress in rehab. Continue to use ice as well. Ice is a great friend. It's a good adjunct to use with your medication. It's a natural anti-inflammatory, natural painkiller, and you just can utilize it throughout the day in between times that you're taking the medicine. So that's also a really nice thing to do. Take medicine, maybe an hour or two later, use some ice before your medicine wears off, or use it again before or as the medicine is wearing off as well. Lastly is to keep moving. So tendency is maybe I want to be in bed all the time, or I want to be in my favorite chair all the time after back surgery, but you want to get up and move around quite frequently throughout the day. So you don't really want to sit more than an hour at a time. So always getting up and moving, short walks, just moving around the house, doing some exercises. And you can clarify what exercises that you can do post-surgical after your back injury with your doctor and then even your therapist before you have surgery, so that you know what you can do after surgery until the time that you get referred back to starting outpatient physical therapy. If you have any questions about these, please don't hesitate to give us a call. The tips will be below in the box. So take a look at those, share those with your friends if you know of anybody that might be having back surgery. Like I said, if you have any questions, please give us a call at 630-892-8003. We want to be a resource for the community, and hope you have a great week. See you next week for your weekly cup of Joe. Bye.